Here's our host, Tian Wei.
Hello and welcome to World Insight. The program is coming to you live from Beijing. I'm Tian Wei. We start with the latest on the coronavirus outbreak. The total number of confirmed cases in China is now well over 40,000. Meanwhile, millions across the nation have begun trickling back to offices and factories after the Spring Festival holiday turned into an extended quarantine. But many still remain at home. Take a look at the latest situation.
The total number of confirmed cases in China has gone beyond 40,000. As of 7:30 p.m. Beijing time, the death toll stands at 909. More than half of the confirmed cases and most of the deaths are in Hubei province, where the epidemic began. The silver lining is newly confirmed cases outside Hubei have dropped for 6 consecutive days by nearly 50% compared to the highest number on February 3rd. Meanwhile, millions of people across China are returning to work today after the extended Chinese New Year holiday ended. National Railway authorities expect 17 to 23 million trips per day in the next week. Beijing and Shanghai have each seen an influx of over 1 million people so far as migrant workers return. But more are expected back, as around 10 million people left the two cities before the holiday. There was a sharp decline in trips made over the Chinese New Year holiday this year. The Ministry of Transport said there were just over 11 million trips on Saturday, 84% fewer than the same day during last year's Spring Festival. And in the last 30 days, nearly 1.4 billion trips have been made, down 40% from the same period last year.
All the latest information, how are we going to digest them? What is next? For more on this, joining us in Madison, Wisconsin in the U.S., Xi Chen, an assistant professor of health policy and economics from the Yale School of Public Health. In Berlin, we are joined by Jonas Schmidt-Chanasy, who is a professor of arbovirology at the University of Hamburg. Gentlemen, welcome to our program. I want to start by asking you, both of you, with millions, probably hundreds of millions, coming back to first to third-tier cities because that's where they work after the Spring Festival holiday. What can we expect? Likely to be another peak of confirmed and suspected cases as time goes by? Mr. Chen, first.
I think currently in Wuhan, in Hubei province, we would still expect the cut down of the transportations, the traffic. But in other parts of China, the cases have been down for a few consecutive days, and which is encouraging. And more flexible measures may be done to facilitate everyone's daily life as well as protecting people from being infected.
But
so
Mr. Chen, if I could be frank here, I mean, the number we are seeing down is a result of policies taken earlier during the Spring Festival, during the quarantine. So what we are going to have now is likely to be the result of what's happening now in about 7 days, because there's a hibernating process of the virus, as we know. If not 24 days, the longest one we have found is 24 days. So, Mr. Chen, when you just said that there seems to be a likely trend of going down, is that scientific or wishful thinking?
Yeah, so far, if there's only 2 or 3 data points, then it may be too small in terms of statistical power. But since it become a trend for 6 consecutive days, especially for areas outside Hubei province, and we know that those areas are more prepared to this virus outbreak, as they had more time to respond to the incidents compared to Hubei province. So they are more prepared, they are more knowledgeable, people are more aware of this disease. So I would say they are in a better situation, and the data already show this. And the people are taking cautious measures to avoid being infected. So I think the self-isolation quarantine was in good condition, and if we look at the street in China, it's very much empty. So that means the compliance rate of the government policy to curb or contain this virus has been accepted by the general public in those areas.
One of the things that we know about the virus, Mr. Schmidt-Chanasy, is that some of the patients at the early stage of being affected by the virus actually did not have any symptom. Only after 3 to 7 days and sometimes 14 days. Earlier, I also said that there's the latest case mentioned by Dr. Zhong Nanshan, that's 24 days. That symptoms begin to appear, and only when they have symptoms they would go to doctors for treatment. At what time the doctors would be able to do the test for these patients. So what we are having right now, the numbers are mainly the ones already have symptoms and to a certain degree already very sick. So there's a huge, seems to be, gap also between the one that could be affected to the number that we are having for confirmation and suspected. Having said this, my point really for you, Mr. Schmidt-Chanasy, is that what measures need to be taken now, since people have to come back to work, the economy has to go on, people have to live. So how should we keep that fine balance?
Yes, I completely understand your question, and this is the most critical point that we need to answer, because there is not a clear answer now. Are asymptomatic people that didn't show any symptoms are a risk for transmission of the virus? So may they transmit the virus to other person that might become sick later? This question is so far not answered. There are cases described in the literature by my colleagues also here in Germany that clearly show that asymptomatic people that didn't show any symptoms can transmit the virus. So the question is the extent of this transmission chain. Is this a major mode of transmission? If this is the case, then containment would be very, very complicated, and we need to focus on the other measures that are already taken in China, so the treatment of the severely ill patients. So, but this is not the situation yet. We still have to answer this question. Also, if the surface is contaminated, for example, with droplets, how long is the virus infectious on that surface? Is also a very important question to answer, also for the containment. And again, we have to separate the situation in Wuhan and Hubei from the rest of China, as mentioned before, and also the rest of the world. So what the situation is now in Hubei and Wuhan is that it is a bottle of water. We have a lot of holes in this bottle, and WHO, China, tried to put the fingers on those holes. So far, we are successful. However, the virus drills new hole every day. So this is the fight that we are doing now.
That has a lot to do with the nature of this virus. It's very much infectious. However, at the same time, when it comes to death rate, if compared to SARS or MERS, it could be lower. Of course, this is also on the condition that we do not know the overall number, because many do not have the symptoms yet. So, but if I could, Mr. Schmidt-Chanasy, to follow up, according to the latest article provided by Dr. Zhong Nanshan recently, there had been a case study of 1,004 patients. Among them, almost 35% did not have any fever or symptoms related to that, even during the hibernation process. And also, at the time when they're being regarded as suspicious cases. So you see a very diverse kinds of cases when it comes to how people would be like when they are infected by this virus. So this gives another layer of difficulties for doctors and also first responders to do what they can, isn't it?
Yes, I completely agree. This study was very important to have, especially with such huge numbers of patients. We're really waiting for such studies, and it shows that the situation is quite complicated. On the second part, we need differential diagnosis. So the people that are not severely ill, they might have other diseases like the flu. So we need to separate them from the one infected with the coronavirus. And the most important point is a very huge benefit would would be if we have bedside tests, point of care tests, that we do not need to transport samples to the laboratory, that we can test the suspect cases bedside or in the stadium, or they can test themselves at home and stay in quarantine. This would be a huge benefit for the containment of the outbreak.
Talking about testing, Mr. Chen, if I could go to you about that. There were earlier test kits being used. However, people later realized there could be many loopholes to these test kits. It's not necessarily these test kits are not perfect. I mean, no test kits can be perfect under such situation. But what is even more important is that, you know, there are so many different kinds of circumstances in which the test kits are being used, and therefore there could be a gap between the reality and what the test kits could really help us to understand about the situation. So your take about that, as a result of it, what does that mean, what we are having right now?
So that means there's a large challenge to the local health community centers, because so far China have tried to implement, I would say, 4-tiered management system. So people need to, the suspected cases, they are first tested in the health community center. But if many of those diseases are without symptom and the tests are not standard, so that poses a challenge to confirm those cases. But after that, the confirmed cases are people are going to the Fangcang Hospital and the shelter, the quarantine center, the quarantine camp. And those are with a lighter disease, lighter symptoms. But for those more severe disease patients, they are going to the Huoshenshan, Leishenshan. The most critically ill going to some specialized top tertiary hospitals. So I would say the more pressure currently is on the primary care system, which is the community health center. But we know that in the last 10 years, China's healthcare reform tried to empower them to integrate the service in the primary care system with the hospital. But we still need a long way to go to empower them, because currently the hospitals are so big and the patients trust more hospitals. So that's why there's understaffing in the local communities.
Right.
So at this moment, very difficult moment, I would say that they may need to try multiple ways. For example, I know that the CT scans are more appropriate in testing them. But I know there's a shortage in the medical supplies. For some areas, is there any way to ship some medical supplies, the big machines with more accurate testing to those, especially in the epicenter, where there are many more such cases?
Now, there's a lot of logistical difficulties as well. And meanwhile, as you may have heard, there are 2,000 strong team of some of the best doctors in this specific area from all over China that are going to the epicenter to Wuhan and some of the other surrounding area. But still, it is lack of the medical help that it needs with such a scale of outbreak. This is another story. What I want to talk about now is more about the science part, because both of you are working on that part. Mr. Schmidt, China C, why do we, at this stage, still know so little about this novel coronavirus, even though 17 years ago, we, meaning all of us here on Earth, already had the SARS. Earlier, we also had the MERS as well. So this time, why we still, with already 1 month, as we consider it as a big threat for all of us, know so little about this virus?
Yes, I mean, first I have to mention this new virus is not SARS. There are very important differences when
No, they're not SARS, but they're all coronavirus themselves. And also we have seen very slow movement of research concerning coronavirus since 17 years ago until today, whether it's vaccine or some of the treatment, therapeutic treatment.
Yes. It is clear, because we didn't have any SARS patient anymore since 70 years, so it was not possible to bring a drug into clinical trials or a vaccine. What we have is a blue pause that we can build on. There are large vaccine alliances that we can use now to be faster, to develop a vaccine candidate and bring it into the clinical studies. This is what is the benefit since 70 years. But I really have to mention that if there are no cases with SARS and MERS, it was quite limited to the Arabian Peninsula. We cannot do much in this regard. And the resources are limited. There are other emergent pathogens that we need to care about, Ebola, Zika virus. So resources are limited, and this is the reason why we didn't have a drug available or vaccine available for these new emerging pathogens.
If I could follow up about that, sir. We've seen, apparently, as some have pointed out, a speeding up process of coronavirus mutating and changing, and also different types of coronavirus being bringing to us public health emergency one after another. After SARS, we also have the MERS. Now, not long after MERS, we've already have this novel coronavirus, 2019 novel coronavirus. So is there an apparent pattern of this coronavirus development in terms of speed? What does that mean for the medical and research community now?
I would not say that there is a specific pattern. What is the same is that is a zoonotic virus. So all of these MERS, SARS, and the new coronavirus are transmitted from wild animals to humans. So this is an important point. So the barriers between wild animals and people, especially in Asia, are destroyed. So there's no barrier anymore. There are close contacts, and this is more intense, especially when compared to 70 years ago. So this makes it very complicated for the containment, because the new infection spread so fast in Wuhan that it was impossible within 1 or 2 weeks to get this outbreak under control. Even the virus was identified very quickly by the Chinese scientists. So this is the situation that we face nowadays, and this situation can't be changed in the future, because, I mean, those contacts exist, or we have to change the cultural behavior. So a Chinese traditional medicine sometimes belong on those animals. So we really have to work on this, but it is not an easy task.
Tom talk about the cultural behavior, others talk about climate change. There are many factors that could have an impact. We do not know yet whether they are 100% confirmed having a direct impact on this, but certainly there's a lot of food for thought. We are not yet going into public policy. I want to start once again to bring all of us to the science part as well, because this part is extremely important right now in terms of how to handle an emergency that is still boiling. Let me ask you about this. If China could hold off to the front line of the spread of this virus, we have seen this nationwide campaign China has been working on, and also the sealing of the city of Wuhan, meanwhile. If China could hold on to this, of course, the other parts of the world do not have to worry much. Or do they still? With this hectic traveling people are having as a result of globalization, which is part of our life. What does this mean for a virus that is not likely to die? Of course, it will still exist. So what does that mean for all of us, even in the middle and the longer term? Mr. Chen.
So I would say in the longer term, the evolvement of the disease will follow natural selection, like SARS. SARS was disappearing, never came back. But we don't know about this coronavirus. But eventually, with more development in the vaccine system, international collaboration in information sharing, developing of the antiviral drugs, and our development of our human immune system to adapt to that, this may become something more like a big flu, and the human societies need to be repeatedly fight against this over years. So that's very important to have a public health campaign and to have a larger scale and prepare for it to recur. And I would say that it's very important during this process that public health scholars, epidemiologists to join hands with the doctors, because at this moment we know that all the doctors are fighting, are saving lives. But it's important for the public health workers, public health scholars, epidemiologists throughout the world to join hands to find the source of this virus.
Yes.
After finding the source, we have better idea how that transmits to the human society.
Right.
And back to more than 100 years ago, the start of epidemiology started from John Snow, the English scholar who dealt with the cholera virus by looking at the source of the water where the cholera virus came from. This made a huge contribution to the fight against the virus at that time. So I think this time the public health researchers need to step in to contribute more, along with the saving lives missions of the doctors.
Mr. Schmidt-Shaughnessy, you only have 30 seconds left. Any final words for this round of discussion?
I completely agree on the statements. One Health is important, but I see it in a good way. We have a very open discussion with our Chinese colleagues. Now 400 colleagues are in Geneva at WHO discussing all the issues. So this is exactly what we need to do now.
Right. WHO has sent a special delegation to China to exchange with the Chinese scholars today, and also we're likely to see a global forum taking place later this week on the controlling of the outbreak of coronavirus, this coronavirus 2019. Thank you so much for both of you joining us. Xi Chen, Jonas Schmidt-Shaughnessy, really appreciate it. Be healthy.